Hi, I'm Russell Vinik, Medical Director at GBS Benefits, and today we're going to talk about folate and folic acid. So, jumping right in, what I'd like to talk to you about today. First, what is folate? What does it do? Signs and symptoms of folate deficiency. And then finally, a little bit about folic acid supplementation. So what is folate? It's also known as vitamin B12. It is acquired from the diet in multiple foods, including leafy green vegetables, nuts, beans, avocados, and milk. You'll see from this diagram on the right here, it is absorbed in the proximal duodenum, which is the first part of the intestines. And so it requires an intact intestines to be properly absorbed. And then we'll also talk about the term folic acid. What that is it's the synthetic form of folate, and that's used in fortified foods, wheat flour, pasta, breads, and cereals. And it's also used to make the multivitamins and folic acid supplements that many of us take. So what does folate do? Well, pretty simple. It's required to make DNA, amino acids, and proteins. So pretty much all the building blocks of life, why it's an essential vitamin. Importantly, it's needed for the development of a fetus's brain and spinal cord, and also required to make red blood cells. So some of the symptoms of folate deficiency: anemia is quite common, often presents with fatigue, paleness, shortness of breath. Other oral symptoms: patients may suffer mouth sores, ulcer, tender red tongue, or neurologic symptoms. The most fearsome one that we hear about is spinal cord defects in developing fetus and babies, and then other neurologic symptoms such as memory loss, difficulty concentrating, confusion, depression, and maybe even weight loss. So causes of folate deficiency, let's break this out into three main categories. First of all is lack of absorption. So people with a very poor diet, who don't get any vegetables, meats, cereals, grains, are at risk. I see this commonly in hospitalized patients suffering from chronic alcoholism, where they substitute food for alcohol. And of course, alcohol has no nutritional value. And so those patients often become deficient in many vitamins and minerals, including folic acid. And then areas where one doesn't have an intact intestinal system, such as Crohn's disease, where the intestines are inflamed, or people who've had bowel surgery, including bariatric surgery. Those patients can become deficient in folate. There's several drugs which impair folate metabolism, methotrexate being a common one, as well as multiple other anti-seizure medications. And then there's conditions that increase the need of folic acid. Commonly pregnancy, you're making more blood, you're making more proteins, you're making a whole baby. And so your body and the baby's body needs more folic acid in order to grow and develop. And then there are conditions where there's increased need due to blood cell turnover. Hemolytic anemia is a disease where the blood cells are destroyed by the body. Another one, sickle cell anemia. And in those patients, they have high turnover of blood cells, so they need more folic acid so they don't become deficient. So who should get folic acid supplementation? First of all, women of childbearing age. So it's very important that a woman have good stores of folic acid at the time of conception, and not waiting until one becomes pregnant. And so the recommendation is that any women of childbearing age should take 400 micrograms per day of supplemental folic acid. That's about the amount in just about any over-the-counter multivitamin. Once a woman becomes pregnant, their needs for folic acid go up. So the general recommendation is 600 micrograms or more, which is about the amount seen in prenatal multivitamins. Next group who needs folic acid supplementation is people who are on some of those medications we discussed earlier. And then finally, women who've had babies with neural tube defects, or maybe people who have first-degree relatives with neural tube defects, and even gestational diabetes. These patients often need increased doses of folic acid, and it's very important to consult your doctor to determine what's the right dose of folic acid for you. So just in summary, folic acid supplementation is simple and significantly reduces the risk of neural tube defects in the developing fetus. Once again, my name is Russell Vinik. I'm a medical director at GBS Benefits. I appreciate you joining me today, and we look forward to seeing you at another session.